Okay, so I've just come into my patient's room and I did wash my hands. I like to just double check their ID band right away. So I have Catherine Canador, their ID number is the same, and I can also get them to verbalize their ID. So that's done. Next, what I like to do is another IV assessment. I've been out of the room for a little while, so I'll do another look, listen, and feel of the actual IV site, but I'm gonna take it one step further and I'm gonna double check the bag, the pump, and the line. So the bag is sodium chloride, that is what's ordered, so I know that it's the correct IV solution that's hanging. I follow the line down, making sure that the integrity of the line is good and that it's free of any air bubbles. I look at the actual pump itself and I look at the rate in mils per hour. It should be what's ordered, and in this case the patient's just getting it TKVO, which is 30 mils an hour. I then also look at the volume remaining. So this says 235, and I always compare it against what's actually in the bag. So a lot of the time we back prime a lot throughout the day and nurses just forget to adjust that number. So make sure that this number is always less than what's in the bag so that our bag never runs dry. So I know that I'm okay there. Next, I'm going to follow the rest of the line down all the way to the patient's site, again inspecting for integrity and making sure that there's no air in the line and it's good, so I feel confident to attach my secondary to this one. So I'm going to go ahead and hang my secondary bag up. I'm going to open the packaging. Remember, you have to hang your primary lower. Take your tubing out of the bag. There's a white tape that's usually around it that you're going to remove. You need to inspect the integrity of your line and then put your clamp on right away. There's two different ways on your checklist that it tells you how to prime your line. So when you guys primed your primary IV solutions in first year, you would have spiked it and then slowly opened your roller clamp and primed from the bag down. You can do the same thing with this one, so I would spike, slowly open my roller clamp, and I would prime until the medication gets to the very tip of my secondary IV line. However, we don't encourage students to do that because if you're not able to prime in a controlled manner, there's a risk of losing medication. Your checklist, however, does explain how to do it both ways. The way that we like to teach you is back priming, and that way you're not going to actually run the risk of losing any medication. So what you're going to do is you're going to attach your secondary line, okay, to the port closest to the your primary bag. So you need to sanitize it. Remember, it's a closed sterile system. Maintaining its integrity and sterility, you need to attach these two. Okay, it's a lure lock system. Okay, my clamp is on, so it's not back priming yet. Okay, slowly, I'm gonna open my roller clamp. I'm keeping this upright so that I can see my chamber filling. There is a fill line, okay, so you need to fill it no more than half full. If you hold it this way, it's just gonna keep leaking out the cap. Okay, so I'm gonna slowly open my clamp. Watch the fluid come into the drip chamber. Once I have where I have the fluid where I want it to go, I just close my clamp completely. Next, I can take off the blue rubber stopper. Maintaining sterility, I'm going to spike my mini bag. Okay, and now we're able to set our pump. So I'm going to hit secondary. Okay, remember what we figured out was 200 mils an hour, so that's our rate. And our volume to be infused is 100. So I know that for primary, we always do a little bit less. For secondaries, we don't. So we're just gonna put 100. I'm gonna confirm, and then I'm gonna hit start. I need to make sure that my clamp is off. And then before I walk out of the room, I need to make sure that it's dripping from the actual secondary bag and not my primary. Had I left this clamp still on, okay, it would just be pulling from my primary bag. So a rate that's supposed to be TKVO would then be running at 200 mils. Okay, that is a med error, and it's a common error, okay, that is made. So please, please, please get in the habit of making sure that it's actually dripping, okay, from the right line. So if I'm confident that it's dripping from the right line, I'm just gonna place my patient back in a comfortable position. I'm probably gonna come back in roughly 15 minutes. For a few reasons. One, I want to make sure that it's still infusing, okay, because if it's dripping, you can usually assume that it's patent, but if it's gone interstitial, it could actually just be leaking in the surrounding tissue, so it'll still be dripping here. So pull your blankets back, make sure that you're eyeballing that IV site still. Also, if this is the first time my patient's been receiving this antibiotic, I want to make sure that they're not going to have any adverse reactions to this drug. And I just want to see how the patient is feeling while receiving this infusion. This is going to take 30 minutes. Okay, so because I didn't stop the pump, I just programmed my secondary while my primary was already running. After the 30 minutes, my pump's just going to kick back into its primary setting screen, which was 30 mils per hour. And because this bag is empty, it's just going to start pulling from my primary bag. So I actually don't have to change anything. I don't have to or move my primary bag higher, and I don't have to change any of the screens. And I can actually just leave my secondary set hanging there until I'm ready to come and either hang another medication, or I can just discontinue it altogether if, let's say, this was the last dose they were receiving.